I do not want to pivot to healthcare because just this morning, President Trump unveiled what he dubbed the Great Healthcare Plan. He said it's going to lower drug prices and insurance premiums, as well as hold insurance companies accountable. And one of the hallmarks here of lowering insurance premiums is instead of sending taxpayer-funded subsidy payments to insurance companies, it's going directly to Americans. It's going into something like an HSA so that they can have the money and they can buy their own health insurance. The plan, though, doesn't include an extension of the enhanced ACA tax credits. So what do you make of the plan that was laid out?
Look, President Trump in this case, they are right on the approach. And Brittany, you and I had the chance to talk about this in the past, but the United States per capita or individual healthcare costs is the highest in the world by far. It's not even close. We spend in excess of $15,000 per person. The next closest country in the world is 9,000. And of course, the average is probably somewhere around 4,000, maybe 5,000 in comparable or developed countries. And so it is obscene what we're paying in the United States. And to suggest that the policy solution is just to come in and subsidize and subsidize and subsidize these excessive costs is completely flawed. We have got to provide transparency in healthcare costs. I think what the president's trying to do by giving these dollars directly to individuals is it's allowing the market forces to prevail as they will, allowing people to be consumers and not go pay these excessive costs in cases when they're being imposed on consumers. But an important part of this is transparency. You should not go to the doctor, the pharmacist, or anywhere else and go in and not know what it is you're going to be paying. When you go to the grocery store, you know the cost of products that you're going to buy, and it should not be any different whenever you go to a doctor, a hospital, or elsewhere. And this is, I think, a big step in the right direction, because I'll say it again, it is fatally flawed to suggest the solution is to continue to subsidize these excessive healthcare costs where the United States is so far out of bounds.
There's a lot of disagreement in conversations with Republicans and Democrats when it comes to healthcare. One thing everyone does agree on, though, is that it's just a mess and it's too expensive. Those are the two things that everyone can agree on. But do you think, and it seems like based on my conversations and based on where things are at right now, that a non-starter for Democrats is not an inclusion of at least a temporary extension on the enhanced ACA tax credits? Do you think that that is something that Republicans can get behind? Do you think that that's something that will pass? Maybe a temporary extension of that paired with perhaps other things in this healthcare plan?
I think that you will have some Republicans that would be willing to support a temporary extension, but I can't say it enough, Brittany, to suggest that you can simply subsidize your way out of this. I want to remind you that when the Affordable Care Act or Obamacare was enacted back in 2012, there was a single subsidy that was put in place for year after year. The subsidy that is being fought over right now is a second subsidy that was put in by Democrats intentionally on a temporary basis. So folks are saying the Republicans are taking away a subsidy. No, they're not. This is a subsidy that Democrats wrote all by themselves. It expired in December of last year because that is the way they wrote it. It was designed to be temporary. No one has taken away anything, and you will not solve this problem long term unless you fundamentally address the flaws in the healthcare markets and its lack of transparency and the excessive costs in the United States. We will be here year after year having this exact same fight and continuing to waste not millions or billions, but trillions of dollars in excessive healthcare costs without fundamental changes that I think President Trump is seeking with lower prescription drug prices and allowing consumerism to force markets to move in the right direction.
As of right now, Republicans have the tiniest advantage in the House. I'm curious, what do you make of the midterms here? It's such a slim majority. Do you think that Republicans will hold on to the House?
Look, I think that they have the record to hold on to the House, and it's all going to be about messaging. If I got to choose which party, putting the ideology aside in terms of which one I prefer, I would choose the record of Republicans over Democrats right now. I think that it's crystal clear that Republican policies are the ones that make the most sense. You know, I remind you, the excessive healthcare costs are as a result of Obamacare. It did not achieve its stated objectives in terms of lower cost, in terms of being able to keep your doctor, in terms of lower deductibles. Everything has moved in the wrong direction there. Energy prices were at record levels under the Biden administration, under policies that the Democrats were putting forth. We had record inflation. We saw some of of the invasions that occurred in the Middle East, the invasions that occurred in Ukraine during the Biden administration, these things didn't happen during Republican presidencies, and I think that was intentional. And so, I'll say it again: if I'm given a choice between which talking points or records of success I'd take, Republicans have an important job to do communicating to the public and helping to connect the dots between problems and solutions. But I think the Republicans have a great trajectory to be able to maintain or grow the majority, but it's going to take some really intense messaging with voters between now and then.